Hello everyone, I am urologist Omar Makaya. Today we will talk about Ligandrol, LGD4033, one of the selective androgen receptor modulators. It is a substance that is thought to be much more innocent and less harmful than anabolic steroids, which have been very popular in the sports community in the last 5 to 10 years. In fact, when you go to the websites that sell it, it is written that it does not damage the liver, it does not damage the testicles, it does not put pressure on the pituitary. But when we look at the scientific studies on it, we can see different results. There is already one publication specifically on Ligandrol, a clinical publication. In that publication, we need to take a deeper look. Because we can actually see different results from what is written on websites. The publication is as follows: 76 healthy young volunteer men were given Ligandrol in different doses. 1/10 or 3/10 milligrams and 1 milligram were given along with placebo, and comparative studies were conducted. Muscle samples were taken, hormone analyses were made, testosterone levels were checked, cholesterol profiles were checked. And the effect of Ligandrol was evaluated. This publication is a very good publication. In fact, I think it evaluates Ligandrol very well, as there is a placebo involved. The doses of the drug sold as Ligandrol on the market vary from about 5 mg daily to 10 mg daily. The maximum dose of Ligandrol used in this publication is 1 mg. In other words, a dose 5 or 10 times lower than those sold in the market was used as a maximum. Well, when you look at the results, as you can see on the screen, when it was used between 1/10 or 3/10, it did not have a very different effect from placebo. So we can say that it had no effect. But when it went up to 1 mg, it lowered testosterone, FSH and LH significantly. It decreased HDL, that is, good cholesterol levels. With this, it started to contribute to muscle development and exercise performance improvement. Now, if we consider that the ones on the market are 5 or 10 times that, we expect a decrease in testosterone, FSH and LH levels. Of course, even if testosterone decreases while the person is using it, there will be no negative development in sports performance and muscle development. But since the endogenous testosterone level, that is, the testosterone produced by the body, decreases, both estrogen and dihydrotestosterone will decrease. This can lead to a decrease in sexual performance. Furthermore, after a person stops using Ligandrol, he may need to perform PCT and stimulate the pituitary again, just like after stopping anabolic steroids. If you have used SARMS or Ligandrol, have your FSH, LH, testosterone and estrogen levels checked after stopping. Have your cholesterol levels checked. Especially have your liver function tests done. Because even if they say it is harmless to the liver, since the use of SARMs has increased significantly in the last 3 to 5 years all over the world, case reports have started to come in. Many reports of patients admitted to hospital with liver damage and jaundice after using Ligandrol, or LGD40, which is also a selective androgen receptor modulator, started to be published. In the clinical study, 76 healthy young people did not have any problems with the liver, but as we said, the doses are low, friends. The websites that reference this study and say that it does not cause liver damage are not very convincing. Because the amount they sell is much higher, friends recommend 5 to 10 times more. And 76 people in this study did not use any other drug while using Ligandrol. For example, when it is used with paracetamol, a substance containing acetaminophen, liver damage is even more severe. Now paracetamol, brand name Parole, as it is known, appears to be one of the most innocent painkillers on the internet. But when you use high doses, it damages the liver, and may cause serious problems in the liver. Because if you don't want to use nonsteroidal anti-inflammatory drugs such as Diclofenac, Voltaren, Majesic or Apronax and use paracetamol for muscle pain because it is more innocent, you start to burden the liver with Ligandrol. Others, namely Diclofenac, Voltaren, Majesic, Apronax are a little more problematic for the kidney. Paracetamol is also one of the painkillers that cause problems for the liver, friends. Or if you consume alcohol, with Ligandrol, of course, liver problems and damage start to occur. In general, this is how LGD4033. If there is a question you want to ask, you can write in the comments, or you can consult on WhatsApp. Thank you for listening, best regards.